clear E-liners, clear aligners? What are those things anyway? What clear aligners, clear E-line, A-liner? I can't. Here's a photograph from the recently completed course that Dr. Lee Boyd and I conducted in Atlanta. Specifically, the topic centered on the use of clear aligners in the mixed dentition. Quite a cast of characters here, very highly qualified, highly respected orthodontic specialists, dual-trained pediatric dental orthodontic specialists, pediatric dentists, and general dentists. Now, some information about the next step. How's the hair? Yeah, okay. Essentials and beyond. Clear aligners, what about these things? Certainly, I was in the camp that believed when these devices were first released that they were a bit of a joke. Well, they're not a joke, and the marketing behind clear aligners is nothing short of astonishing. I mean, like tectonic plate shifting marketing of clear aligners. No one can deny that this is an essential part of dentistry, an essential part of orthodontics. April 18, 19, and 20, 2024, that's April 18, 19, and 20, Lee Boyd and I will be offering a course called Clear Aligners, Essentials and Beyond. This will be a limited attendance course of only 35 people. The course currently, as I'm making this video, is half filled. Now, what are we going to cover in this meeting? No hassle ways of incorporating clear aligners into a dental practice, mixed as well as permanent dentition. Now, I'd like to make you understand the permanent dentitions we are talking about are teenagers. Yes, not real, what I would call real adults with their perio and endo issues with bone grafting. No. One of the most essential aspects, and perhaps one of the most daunting, if not confusing, is how does one incorporate clear aligners into an existing dental practice? Lee Boyd has developed very, very sophisticated, simplified ways to incorporate clear aligners into your practice without throwing an entire mess into the business operation and have the team go kind of nuts. Lee has that all ironed out. What else will we cover, you ask? The essentials of diagnosis, prognosis, and treatment planning, comparing clear aligners to fixed appliances. That's essential diagnosis, prognosis, and treatment planning of using clear aligners in the mixed and teen-aged permanent dentition. Well, attachments. That's one of the biggest confusions. The attachments that are placed on the teeth or the attachments that are incorporated into the aligners. Why are those attachments necessary? What about the size of the attachments? What about the actual distance between the attachments on the crowns of the teeth and the shapes of the attachments? We will cover that in excellent detail, simplified detail during this 2.5-day meeting. We will also cover class 2s, asymmetries, anterior crossbites, ectopic eruption, and the popular and controversial topic of expansion. What about expansion with clear aligners? Of course, the gnathosce methodology always includes problem solving and a festive, engaging team approach. Yes, you will be on a team. You'll love it. You're going to go crazy. Yeah, well, remember, this is a limited attendance course, 35 attendees. That's it. It's a boutique, small setting. Hands-on things will be emphasized. Literature support will be shown when indicated. Opinions will be given and clearly stated as such. Those dates again, April 18, 19, and 20 in Atlanta. That's Thursday, Friday, and Saturday, a gnathosce meeting, essentials and beyond, through the new division of gnathosce called Clearly Gnathosce. You can read the description that we have for you attached to this message. You don't want to be on the waiting list. You don't want to miss this opportunity because you'll be very sad. You'll miss a great time.
Mama ko, mama sa, mako, mako sa, mama ko, mama sa, mako, mako sa, mama ko,